Hi everyone, I'm Megan, occupational therapist at Summit Home Care and Home Healthcare Inc. for those of you who don't know me, and welcome to our first PowerPoint in a set of three that are each going to be about 20 minutes long, introducing you to kind of the basics of the interprofessional fall risk prevention protocol and how we're going to be using it and implementing it in our home care setting. So just to give you an idea, this first set of slides is really going to focus on some fall statistics as well as the importance of fall risk prevention. It's going to explain the approach that I'm using, which is STEADY, which is stopping elderly accidents, deaths, and injuries. And it's going to talk about how that uses a screening assessment, then looks at fall risk factors and interventions as a way to help work on fall prevention across a variety of settings. So this is really just going to be an overview of how we can address fall risk from a team approach. So all of the stats you see here and that you're going to see in the following slides come from STEADY, which, like I said in the slide above, is the Stopping Elderly Accidents, Deaths, and Injuries program. And this program was developed by the Centers for Disease Control in response to the falls crisis in older adults. Here's some of the statistics that'll just show you how much of a crisis this is. So the first one here is an older adult falls every second of every day. The second statistic is that 1 in 4 older adults reported a fall in 2014. So that was 25% of older adults. Last statistic here says that falls are the #1 cause of hip fractures. So just looking at these statistics, we can tell that fall risk prevention is very important for us to be looking at in home care. So here's another staggering statistic. Every 20 minutes, an older adult dies from a fall in the United States. Many more are injured. So this is just another slide that really shows you the importance of fall risk prevention in all types of settings, but it's especially something we can address in home care. So here are some more statistics that it's important for us to be aware of. This says falls among older adults are common, costly, and preventable. So common, like we talked about before, 1 in 4 older adults falls each year. Costly, this is a really big one for us. Look at the enormous Medicare, Medicaid, and private out-of-pocket expenses for falls. $50 billion annually when you combine all of those. And if you look specifically at Medicare, which is a lot of what we see in home care, it's $29 billion a year. So this is something that's really important for Medicare. And as we've seen in kind of the new OASIS trainings, we're learning that we're now tracking falls and looking at fall risk. So this is a really important thing for us to be doing in home care as well. And in that last part there, that they're preventable. And STEADY put this little piece in that clinicians can use STEADY to prevent falls and reduce costs. And in our case, we can adapt some of the materials from STEADY and really focus it on home care and us using an interdisciplinary approach to really help prevent falls in home care. So now I've listed two really important aspects of STEADY that are really good, not just for us in home care, but for clients who are seen in a variety of settings. So the first one is that STEADY really focuses on having a coordinated approach to fall risk prevention. So the client could be seen by us in home care, and then the nurse or physical therapist would do that initial fall risk assessment to determine what their fall risk factors are. And then from there, they would get everyone involved that needs to be, depending on those factors. You know, this could also be done by an emergency room doctor if someone comes in and is a high risk of falls, to make sure they follow up with their primary physician based on medications or recommending, therapies to come in at home or outpatient. This could also be done by just a primary care physician when a client comes in, says they've had a fall, and then they can assess what their fall risk factors are and where to refer them to. So the main goal of this is that we're really looking at what are all of a person's fall risk factors, and then who can best address those fall risk factors, and how can we collaborate and make sure all those fall risk factors are taken care of and they have the best fall risk prevention possible. So the second fact here is that the great thing about study is it's really well based in evidence-based practice. So they use the American and British Geriatric Society's clinical practice guidelines to formulate everything you see here. So all of the different materials and everything we're going to go over that this protocol is based on recent evidence. The other thing study did was also take into account clinician experiences and do some interviews with people over talking about, what they felt about the materials and things like that. But the most important part is that everything is based in evidence. So this next slide looks at the study algorithm for everything from screening to assessing to intervening with fall risk prevention. So the first step, whether it be in an outpatient setting, the hospital, primary physician clinic, or home care, you want to screen that person to see if they are a fall risk. So it can be as easy as asking if they've had a fall lately. You can do some of the screening tools to see what their fall risk would be. And then if you determine that person is a fall risk, then you go to the assessment stage. So what are these identifiable risk factors that they're having? Are they having decreased strength or balance in their legs? Are they having a medication that's causing them to be dizzy or drowsy? Is there something in their home setting or something they're doing that isn't set up well for them and makes them a higher risk for falls? And then the third step here is intervening. So making sure you have the right clinicians involved that are able to address those fall risk factors that you've seen and make an impact on the clients to decrease their fall risk. So first, I'll show you one of the easy screening techniques here. So you can really even just ask people these 3 basic questions to get an idea of their fall risk. First one, have you fallen in the past year? Second one, do you feel unsteady when walking or standing? And then lastly, are you worried about falling? Do you have that fear of falling? So these 3 questions will really give you an idea if a person is a high fall risk. This next slide is very interesting because it's a more in-depth screening tool that can be used to assess fall risk factors. So this may not always be feasible for us to use in home care due to time constraints during a start of care or an evaluation. But it is something that I think is important for us all to note and just keep in the back of our mind when we're working with clients. It gives a list of statements here, and every time a client says yes to a statement, you can look at the final column, why it matters, and that basically just gives you an idea of what the fall risk factor is. So I'll go through the list just so we can kind of have an idea to keep in the back of our minds. So the first statement is I have fallen in the past year. So if a client says, yes, I have fallen in the past year, this is important because people who have fallen once are likely to fall again. The second statement is I use or have been advised to use a cane or walker to get around safely. So if that is the case, that's important because people who have been advised to use a cane or walker may already be more likely to fall. The third statement is sometimes I feel unsteady when I am walking. If a client answers yes to this, that's important because unsteadiness or needing support while walking are signs of poor balance. Next, if a client says yes that they steady themselves by holding onto furniture when walking at home, this is also a sign of poor balance. Another statement is if a client says yes that I am worried about falling. This is important because people who are worried about falling are more likely to fall. Next, a client who answers yes, that I need to push with my hands to stand up from a chair. This is an important statement because it could be a sign of weak leg muscles, which is a major reason for falling. Next statement, if a client says I have some trouble stepping onto a curb, this could also be a sign of weak leg muscles, which is, again, a major reason for falling. The next statement, I often have to rush to the toilet. So if this is the case for our clients, Rushing to the bathroom, especially at night, increases your chance of falling. Next statement, I have lost some feeling in my feet. So if a client answers yes to this, numbness in your feet can cause stumbles and lead to falls. Next statement, I take medicine that sometimes makes me feel lightheaded or more tired than usual. So if they answer yes to this, that's important, as side effects from medicines can sometimes increase your chance of falling. Next statement is I take medicine to help me sleep or improve my mood. If they answer yes to this, it's important because these medicines can sometimes increase your chance of falling. And lastly, I often feel sad or depressed. So if a client answers yes to this, it's important because symptoms of depression, such as not feeling well or feeling slowed down, are linked to falls. So, and if you look way at the bottom here, it asks you to total the number of yeses. And if you notice at the top, the first two have an extra point on each, so there are 2 points. So you add up the number of points for each yes, and if you scored 4 points or more, you may be at risk for falling. But again, I think the most important part of this screen is that whole right column is going to give you an idea of what the fall risk factors could potentially be for these clients. So in this next slide here, I'm going to discuss all of the main fall risk factors. Now, of course, there are probably dozens of fall risk factors you could think of. So I'm just going to go over the main ones that are focused in the study approach. And again, these can be expanded on, like I said, but here's the main 6 factors that we discuss in study. So the first is a vestibular problem or poor balance. You know, this is going to be a huge fall risk factor because it makes mobility difficult and makes the person a high risk for falls. Second fall risk factor is vitamin D deficiency. Now, this was something I hadn't even considered until I started doing my research with study, but vitamin D insufficiency can play a large role in fall risk prevention. So this is something that really the client would need to take up a discussion with their doctor on, but we could also send a message to the doctor if we see any concerns. You know, typically this is going to be discovered through their labs at the doctor's office anyway, but it's one of those very common risk factors to be aware of. Third is medications linked to falls. So we're going to do in the second presentation, we're going to do a pretty extensive discussion on all the different medications and side effects and how they're linked to falls. So that'll be something you'll be well aware of by the end of all of these presentations. The fourth fall risk factor is foot or ankle disorders. So this is really important, you know, everything from neuropathy to an anatomical problem to footwear, ankle weakness, all of these different kinds of things are something I hadn't considered to be a main fall risk factor, again, until I did this research with study. So that's an important factor to be aware of as well. Let's see here. So the next one, the fifth one, is home hazards. So this is something we do see a lot in home care. You know, how is the bathroom set up? Are there rugs throughout the home? You know, are they managing oxygen tubing throughout in their environment? You know, all of these different factors, lighting, there's so much that can come into play at home. Lastly, the sixth fall risk factor is vision. And this is an important factor that I have noted through all of my fall risk prevention research, is that there's so many different aspects of vision that can really affect a person's fall risk. They're not seeing an obstacle, you know, going downstairs, they might have bifocals on and they're missing a step, or, you know, there's not enough lighting in their house to see something small on the floor. So vision impairment is a very big fall risk factor as well. Okay, so this next slide is going to discuss interventions. So we've gone through the first 2 steps, screening for fall risk and then assessing for what those fall risk factors are. So next, we're going to make sure that we're doing proper interventions to address those fall risk factors. So here is a whole bunch of possibilities. The first would be implementing a strength and balance program. So from a physical therapy standpoint, you know, really addressing any of those lower extremity, core strength, balance type issues the client might be having. Next intervention would be medication management. So if we noted that there was an interaction between medications that could cause dizziness, or if we noted that a side effect of one of the medications was drowsiness and that's really affecting the client, it would be intervening to kind of talk with the doctor about that medication or about that fall risk, and that would typically fall to a nurse, but it also depends on who is involved with the client at that time. So another intervention would be managing hypotension if that were a fall risk factor. Also looking at vision, what we can do with lighting or certain things that would help improve vision and that would reduce that as a fall risk factor. Next intervention would be that vitamin D. And again, there's not as much we can do on that side of things, but making the doctor aware of their fall risk and just, asking if they have looked at vitamin D. Next would be home modification or any of those home assessment pieces, looking at what the fall risk factors within the home environment might be and how we could change those. Next would be managing foot problems. And lastly, and the most important thing we do with people every visit is education. Education on their fall risk, what they can do to improve their fall risk, or to lessen their fall risk, I should say. All those kinds of things are really important in our interventions. Okay, so this last slide here really kind of brings everything together that we've discussed so far. So this neat little algorithm is another tool that was developed by Steady. And again, this may not be anything you use in practice. It's a pretty extensive flow chart, but it's something that's really probably just going to be ingrained in your head and you're going to use with clients. But I'm going to go through it briefly with you guys now. So it says start here at the top. The patient completes that stay independent brochure. So that was the one I read with all the statements that someone would say, yes, this applies to me, or no, it doesn't. They complete that. So if they score greater than 4 on that, or, those key questions we talked about earlier, or if they have fallen in the past year, feel unsteady when walking, or have worries about falling, then they're going to go down to answering the next question on evaluating strength and balance. So anyone who scored less than 4, they're automatically going to go right over to this low risk category to the right there. But we're saying our people were a high fall risk during our screen, so we're going to put them straight down the flow chart to that evaluate gait, strength, and balance. So they recommend a few of the different screening tests or assessments there. Timed up and go, 30-second chair stand, 4-stage balance test, but I know there's some others our physical therapists use as well. So we're going to find out, okay, based on those assessments, do they have a gait, strength, or balance problem or not? So if they don't, they're going to flow right over to that top right-hand side again, and they're going to be a low risk for falls. Now, but let's say they flow straight down and they do have a gait, strength, or balance problem. Then they put you into a few different categories here. How many falls have you had? 0, 1, or greater than 2. So if you have 0 falls, but you have a gait, strength, or balance problem, you're still going to be at a fall risk there. So you're going to be in that middle right category of moderate fall risk. If you have 1 fall with no injury, you're also going to go into that moderate fall risk category. So that's going to be educating the patient, making sure they have vitamin D and calcium, and referring to PT. So let's say that person had 1 fall with an injury, or they fall again into that greater than 2 falls category. They're going to go right into conducting a multifactorial risk assessment. So you're going to do their falls history, physical exam, cognitive screening, footwear check. So they're going to go through all the different disciplines and be assessed that way. Next, they're going to go over to, these are the interventions we're going to do based on that risk assessment. Go through the whole risk of interventions again. And then next, they're going to make sure that they're followed up with, the doctor's aware, we've done everything we can because they're falling into that high risk category. So I hope this first PowerPoint was informative, and the next ones will be based on nursing, PT, OT specifically, and then interventions we can do from an interdisciplinary standpoint. Thanks.